Coimbatore to present her topic.
My heartfelt thanks to Dr.Gnanasambandam and Dr. Jayadass for giving me an opportunity to present a topic over here. My topic is homeopathic perspective in ART. Next. So as we all know, reproduction is the basic desire of every human organism, and this desire is being initiated by the biological and the psychological factors. Next. So this is a female reproductive system, and we all know that is the uterus in the center and the right and the left fallopian tubes, and adjacent to that is the right and the left ovary, which is held by the ovarian ligament, and the cervix with the internal and the external os. Next. This is a male reproductive system. It includes the testis, epididymis and the ductus deferens, and the testis is covered by the tunica albuginea, which sends septae inside it, and that septae divides the testis into the lobules, and each lobule contains seminiferous tubule that in turn form the granules. That cortical granules form the block to the other sperms being entered into it. So that is prevention of polyspermy. Next. This first picture shows that is the morula stage, that is 16 cell stage of the embryo. The next one is the fetus. About 8 weeks we call it as the fetus within the amniotic sac. Next. So the homeopaths does not depend on the investigation, but most of the patients who come to us, they will come with all the reports. So we should know certain reports what we have to done in the investigation of male. That is serology, that is the biohazards. Before going to the infertility treatment proper, we should know whether the patient is having any kind of infections like HIV, HBs, AG or VRL. And next comes the seminal fluid analysis. Now the WHO standard, they said that 15 million is enough for 50% motility and 5% of normal sperms. If there is any abnormality in the seminal fluid analysis and if the count is very low, and they advise for the hormone assay that includes follicle stimulating hormone, luteinizing hormone and the testosterone levels. If there is any abnormality in that, they will prescribe for Doppler scrotum. Next. If you can do anything homeopathically within 1 day, that is in order to avoid the cancellation of this cycle. So on case taking the following, if we see to this patient, she has taken allopathic medicine for more than 10 years. So she has introduced into an artificial disease, and mechanical injury was created to the ovary by the ovarian drilling. So what they usually do is they cauterize the ovary so that the blood supply to the ovary is being reduced over here. And in aphorism 178 we know that the form of one-sided disease, that the actual disease of the actual symptom of the patient has been masked and she has been pushed into the one-sided disease. So on case taking, that particular evening, on 15th day evening, we took the case and there was no symptoms that mentally the patient was highly irritable and depressed, restless, suspiciousness was there, physically she was very weak and tired, undergoing all the sorts of treatment and feel sleepy always, aversion to concentrate in any form of work, intolerance was cold there, then dry scaly skin, she was presented with dry scaly skin. So in this stage if we see, the vital force is so exhausted and it was very sluggish to the stimulus. So that even with high dose of hormone injection she didn't respond. And there is paucity of symptoms. Original symptoms of her has been masked. Next. So in consist repertory by Dr. S.R. Pathak, if we see the growth affected, the disorder of, in that rubric, certain remedies comes that is perita, calcarea, phosphorus, phosphoric acid, silicium, pyrodenum. And in low-dose materia medica by Robin Murphy, if we see that it has been stated in pyrodenum that it will act well in the malnutrition and the arrested development. So what is arrested in this? The growth of the follicle has been arrested and it is malnourished due to the poor supply of the blood, due to the ovarian drilling and all. On this basis, the drug that is pyrodenum has been selected, and since it is a sarcode, it was selected in the lowest potency, that is 3x, and she was advised to take 3 times per day. This is on the 15th day of her cycle. Next. So this is the ovulation study report that on until 15th day she didn't develop any follicles at all. Her endometrium was 7.4 and it was 999. But 15th day was the day when pyrodenum was given, and 16th day she was advised to take 3 times per day and she was advised to come on day 17. And the scan report revealed that one follicle started developing on the left side that it became from 12 mm it has started growing to 14 mm. And the endometrium was also very good, that is 9.4. In previous cycle the endometrium was very thin, that is 5. And again she was advised to come back on 19th day to monitor the follicle growth, and it was around 18 millimeter. So endometrium was also very good, that is 10.2 millimeter, and mild triple egg was given to that particular patient, and the OVG 10,000, and she was advised to come on day 21 for IUI, and the freshly prepared semen sample was inserted inside her uterus, and the luteal support was given by them. Along with that, she was asked to continue thyroidinum until the result. Next. So this is the post-wash semen sample of the husband. It was very good. Next. So in April 7, she came back, and it was a delayed period for her. Urine pregnancy test was done, and it revealed it was a positive. So we had a doubt whether she is a case of PCO. Sometimes the PCO patient may give rise to the result may be mild positive, false positive will be there. So in order to confirm that, on that particular day, ATVS, that is transvaginal sonography, was done. Next. So that is 7th of April, the scan was done, and it showed a tiny intrauterine G-sac, very tiny sac with no yolk sac and fetal hole. So she was advised to continue the medicine, and she was advised to come back on 21st of April, that is 2 weeks later. To the surprise, the sac developed, and there was a tiny fetal pole, and the cardiac activity was established, and she continued the pregnancy and delivered in Kerala.